You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. He is Florida's go-to implant dentist, Dr. Jack Krauser. Dr. Krauser, welcome to the program.
Thank you very much, Randy. I'm really excited to be here, and I'm happy to continue with you.
All right. Okay. Now, you brought a lot of photos. I don't even think we could get them all in. In fact, there's a bunch laying in our green room. Didn't even make it.
That's right.
So, and they're pretty dramatic. So we'll get to as many of those as possible. Now, for people that don't know your practice, like who's the typical dental implant patient you see?
Sure. We have basically two types. The patient comes in, their mouth is falling apart. Falling apart because there's loose teeth, broken teeth, decayed teeth, periodontal disease, which is gum disease, bleeding gums, bad breath. They're just miserable. And they've been to the dentist for many years. It's like a cycle, it never ends.
So they were told what? They need dentures eventually.
Well, eventually they're told that. And now they throw their hands up and go, oh my God, I've been through all of this and I'm going to end up with a denture. People don't want dentures.
Okay.
Unless the spiral has gone on so much that they're actually relieved to eventually get a denture. Well, the people whose mouths are falling apart, we can predictably give them a full mouth set of new teeth that are fixed to their bodies. They function, they smile, they're thrilled.
Nice.
It's an exciting prospect.
Now, what about the denture wearers? You say it's hard to get them in.
Well, I'll tell you, the denture wearers are almost like the lost tribe.
Okay.
Where are they? There's millions of people that are wearing dentures and are suffering. Have you ever heard of denture adhesive?
Yeah.
I always wonder, where is the adhesive at the end of the night? Where is it? The people's digestive system took it in, and it goes into the sewage system of everybody's town. The denture adhesive industry is bigger than the implant industry. So these patients are trying to make it work with their dentures. Now, they actually have gotten lost. We don't see them in dentistry, so they're like out of touch with my office or other offices that can help them. So if you do have dentures and you come to our practice, after our analysis, you can leave with a full set of teeth attached to your body, your third set of teeth, basically.
Okay, good. Now, we should mention, I guess your practice is a little bit unique, where you do everything under one roof. I guess how it's normally done, correct me if I'm wrong, you go to one place for the surgery, one doctor, another place for the imaging, and another place where the doctor puts the teeth on top. You
Right.
do it all yourself. Is it because you're a periodontist or a specialist?
It's exactly correct.
Okay.
It's not that popular, but I chose to do it all in-house because the patients don't like floating around one office to the next. So we could see a patient in our office for a surgical visit. After that, the next day they come back and they get the teeth put in. I work with some very well-trained laboratories with the newest technologies, and we are able to get them the teeth the very next day.
Okay, now, is this true? You told me this on the phone. Somebody could come in on a Monday,
Yes,
and on Wednesday they have a brand new set of permanent teeth.
exactly. The reason why it can't be done
Like no
on...
teeth on Monday and then a brand new teeth.
Yes, it's true. It can't be done Monday. We need some time to actually get it to the lab because they have to fabricate a custom-made frame that fits their exact mouth and have the teeth processed on top. So these are things that just take
But
a
it's
little
like a
bit.
couple of days, though. It's not like much time,
You
right?
could do it Monday, you have the surgery Tuesday, teeth Wednesday. Yes, it's possible. In fact,
Is that unusual?
No, it's not unusual. It's routine. That's what we do.
So in Florida, where you are there a lot of denture wearers?
I can't even imagine how many there are. If you take the Dolphin Stadium, you could probably fill it 3 or 4 times with patients that are either uncomfortable with their dentures or they're heading for a denture. They don't even know that the implant procedures are available for them. So yes, there are
So like tens of thousands of people.
tens of thousands of people. If you look
Like
at
in the state of Florida, there's like hundreds of thousands.
Florida is a Sun Belt state, so we get
Okay.
more coming down from the north. But if you check studies from the American Dental Association, Food and Drug Administration, the Surgeon General himself, edentialism is what it's called. Without teeth, there are millions of people. About
Wow, okay.
a tenth of the population in the United States is having problems with their denture on any given day. Imagine flying to visit your children in, let's say, Chicago. 20 people on the plane are having problems with their teeth. You don't even know it. You go to a movie theater, same thing. There are people that are having problems with their teeth all over the
They
place.
can't eat popcorn, things like that at the movie.
Popcorn, there's food that they can't even eat, the real
okay.
food. Popcorn is the least of their wishes. They would love to eat vegetables.
Okay.
Steak is one of the most popular for the non-vegans that's out there. Randy,
They tell you that on the console?
all the time. Let me ask you this question.
Yeah.
Do you actually think about what cucumbers taste like?
No.
Tomatoes, the variety of tomatoes. I love Italian food, the spices. If you're wearing a denture, the palate is plastic. It goes over the taste buds. You could hardly taste it. Not to mention, the efficiency of the chewing is so reduced that people sometimes can't even actually physically eat what they want to eat. This is dramatic. When they get to eat and taste what they've missed for all these years, and it's just a very dramatic, exciting thing. We get calls like, "Oh, will you come out to the Okeechobee Steakhouse with me next time? It was so juicy. I want to eat it with you and share the excitement." And we do. It's an amazing change.
So if dental implants are so good, right? And there's 1 million people in Florida plus possibly wearing a why aren't they all coming in to do this? What's your take on this?
You know, I've thought about that from time to time. I think the denture wearer got lost. They're lost in the system. They're like not going to an office, so they don't hear that there's an option.
Okay.
So they don't
fair.
even know that an option exists. Now there are several options that are possible. Well, we give them a new set of teeth. From one side to the other, it's a full arch.
So if these denture wearers knew how good it was, you couldn't even help them all, right?
No.
There's not even enough dentists in Florida to treat all the people with dentures.
Correct. We don't have enough dentists in the country to handle the patients.
But this is the future. I mean, for example, dentures as we know them today, like 40, 50 years in the future, you think will be gone? Everything will be supported by implants or attached?
I believe yes. Now, think about a denture. It's a technology that George Washington, our first president, had. It's hundreds of years old. What have they done to make it better? Nothing. They changed the color a little bit. They changed the quality of the teeth. So a denture is like an artificial prosthesis that goes in someone's mouth. Imagine wearing a shoe with a piece of plastic irregularly shaped in your shoe. You walk around with that, it's horrible. And then it gets loose and people have to put the adhesive in, drives the people crazy. On the other hand, we have patients that their teeth are falling apart and they're in fear that will I end up like a denture like my parents used to have or my grandparents used to have. So they just want to know what can be done to help them out. So as we just said, there aren't enough dentists that know how to do these methods to take care of all the people that need it. Back to your original question, Randy, why aren't they all doing it? Well, let's go back in time in each of these patients' conditions, what they were doing.
Before they had a denture.
Yeah, right before they had the denture. Now, it doesn't happen like one day before the denture. This is a continuum. They've had problems, a crown, a broken tooth, a root canal, gum disease, loose teeth, collapsing of the bite, teeth falling out.
Trip to the periodontist.
Trip to the periodontist. Nobody likes that. But they're useful. But it just goes on and on. It just never stopped. Many of these patients, when they get the denture, they actually go, thank God I have something that stops that monotonous treadmill that goes around and around and it never seems to end. However, they like that for a while, but they realize that there's so many problems with the denture for them that they start to either acclimate to it or adopt with it, but they just don't even like it after a while. And then they come in as unhappy denture wearers and we can give them...
And they walk out with brand new teeth that don't come out.
Teeth that don't come out, fixed there. It's just amazing situation.
How old, like what are the upper ages where you could get this done?
Yes, I've had 3 patients that were already 100 when I did their case.
Really? Why would they want to do this?
Well, the main reason is the enjoyment of their family. They want to be able to eat, chew, socialize, play with their great-grandkids by now, and they want to function, feel healthy, but they're tired of sitting around Thanksgiving with their teeth chattering, or the littlest granddaughter comes, "Granny, how come your teeth click?" Or, "It looks so funny when you smile like the teeth drop down." That's why.
So these 100-year-olds literally can walk, also get teeth that don't come in and
The
out?
process doesn't change based on your age. The process may change based on certain materials that I have to use, but it's a quick process the next day, or at most the day after the next day.
How soon can people eat if everything works out?
Everything does work out.
Okay.
And they're eating right away.
All right.
It's like a cast on a leg. You want to stimulate the leg. So we want the people to
Take it easy at the beginning.
You take it easy at the beginning, maybe softer, smaller bites, and they're eating as they go along.
And then before you know it,
they know it, they're eating everything. I've had patients eating apples, carrots, broccoli.
With their front teeth, could you bite into a raw carrot?
Yes, that's the purpose of the front teeth, is to incise and cut into food. We don't want people biting and pulling. We want people to bite, and then you move it back further, and the crunching teeth take place further back. And that's the way normal chewing takes place.
Do you hear eating stories all the time? Like, Doc, are you sure I could eat almonds?
No. They're telling me that they're doing it sheepishly. And then I go, okay, well, you're looking good, Randy. It's still
all right.
So yeah, it's
so they'll
fine.
say, like, Doc, are you sure it's okay to eat almonds? It's okay to eat broccoli raw? They ask you those questions.
Yes, they ask it, but my answer typically is early on, be gentle. Don't abuse them. Mainly because we want the implants to lock into the bone and get the extra, the actual strength to hold the case into position.
But isn't it true, though, if you're wearing a denture, let's say 10 years, you don't have enough bone
I've heard it. This. It's actually not true for my practice.
Okay.
I believe it's probably true for other offices where they may not have skills or knowledge to handle those kind of cases. I don't believe we've turned the patient away because of lack of bone for several years.
All right. Now, we should mention, everything we're talking about today, you teach and have taught other dentists, other specialists across, I guess, all over the world. Is that right?
Well, one of my favorite thoughts is I've lectured in 6 continents at least twice.
Is there that much to it?
Well,
to be teaching all over the world?
Yes. As a matter of fact, I'm still learning. I have taken courses, I've lectured with other global leaders, and I'm always picking up something if I'm at a convention or a meeting. Now, I laugh in a way when I find these, we call them weekend wonder boys or girls. They go to a course for 2 days and they think they're going to do it. If you're really talented, you could probably do it for a simple case. But these advanced kind of cases where people are losing their teeth, the gums are falling apart, they're bleeding, bad breath, they can't smile, they're ashamed, they put their hand in front of their mouth. These are the kind of cases that are way advanced.
I got to put you on the spot here.
Please.
You're a key thought leader on this. You're a specialist, a periodontist. You've been doing dental implants from the onset. Does it cost more to go to a guy like you?
Not in my practice. I like to do the patients. I like to make them happy. I want to see them smile again. And we like to do it correctly the first time. If I have my skills and my knowledge and I impart that to your case, it makes it actually more efficient.
You said you're less than the big guys.
Actually, yes. In my town, we have some of the corporate offices. I see their patients on multiple opinions, and I know for a fact that we're less than these offices.
Okay, good. Now, you brought photos.
Yes, I did.
Let's take a look at some of these.
Okay, sure, Andy. This patient is about to lose her teeth. If you look at the teeth under the lips, you can see they're at different lengths. If we move the gums back, you can see that there's all sorts of discrepancies. Some of the bridge work is decayed, ready to come out. And
so she was headed for a denture.
She could have been headed for a denture. I'm trained as a periodontist. If I could have saved her teeth, we would have.
Okay.
But there was too many conditions that were going and spiraling downhill. One afternoon, we did the surgery and gave her a new set of teeth.
That's very nice.
I could tell when we first met her, she was very nervous, unsure whether she wanted to do the procedure. She was very quiet. Now, I'd like to share with you this photo.
Okay.
This is her a little bit later, about a year down the road.
Nice.
She's hamming it up with one of our other patients that happened to crisscross in the waiting room. This shows the fun that we like to have in our practice. Now, Randy, if I'm talking about having fun, that doesn't mean that I'm careless or slipshod. When I'm working on your case, I'm focusing only on you. The days that we're not doing the surgery, we have patients that come in, they tell their stories, they share information, and you can see how happy she became.
So the guy on her right He
Yes.
also has a brand new set of teeth supported by implants?
As a matter of fact, this is his upper case.
Oh my goodness.
He was wearing a full denture.
That's terrible.
So he had all the typical denture problems. I'm tired of the adhesive. It wiggles. My cousins laugh at me. When I talk, it clicks and chats and back and forth. So he was very happy to receive the new set of teeth, as you see there. Here's another patient.
All right.
You can see also, she has teeth that are falling apart, chipped, broken. The central incisor, the front tooth, has a crack down the middle. If we could save it, we could. But instead, she wanted to avoid dentures, so we gave her a new set of teeth that are fixed to her mouth. She was a little nervous. We did give her a little sedation. She slept through the procedure, boom, took the impressions, done, and smiling.
So this is a woman that would have had a traditional denture.
Could have had
possibly.
a traditional denture if she did not go to our practice. Well, look at the smile. You could see that she actually is coming out of her shell. These people get in touch with, some people call it their inner smile.
Okay.
I like to see the outer smile, but we also like to see the inner smile. And she cracks me up because she gardens. And I asked her, how do you get your dark complexion? You're gardening all the time? She goes, no, I'm Italian. I eat a lot of olive oil. So I said, well, I like Italian food, so bring me a tub. So she's great. We love her. And like I said, she came out of her shell. Speaking of shells, take a look at this gal.
Okay. That's her smiling?
That's her smiling. She could hardly smile. She works in customer service for a major airline at the Miami airport. Well, she could have had a denture. You could see the broken down, decayed teeth. She has no front teeth basically at this point. The side teeth are just as bad. So what does she have an option? She can go to a denture or allow us to do the...
Or Dr. Krauser.
Or Dr. Krauser, and we could do a...
Brand new set of teeth.
set of teeth for her. Now, she likes me as much as we like her. You can see there. Look at how we're smiling. That's a beautiful smile, and we were thrilled to work with her. So much so, she sent us this photo of one of her birthday parties. She got all dolled up, and she even wrote me a letter in Italian and in English because I was going to show her case on one of my lectures in Italy. So she's looking great. Now, I can't prove it, but just look at her. She's smiling. Her hair looks great. She has curves, a beautiful dress. I think the people are coming out from their hiding places. They just were miserable, to say the least.
It definitely adds to the overall attractiveness of the person, for sure.
Look, if you walk into a party or a room with other people, and you look around the room, there's somebody over there with a big smile, smiling away with a smile like yours.
Okay.
And they're like almost hogging the crowd. It's like people gravitate to people that smile. If you don't smile, you're going to have a harder time in life. In fact, there was a study on twins where they took one twin that was smiley and the other twin that was not. The twin that was smiley has more advancement in life.
Okay.
I've actually seen patients of sisters that grew up, one happy, the other miserable, and the happier one had much more things in life than the unhappy one.
So if you don't like your smile, do something about it.
Definitely, and we can help you, and we're happy to do so.
Okay, now I know you have a ton of photos, so I'm going to rush you.
Okay, sure.
And I know, so what do we have next?
Okay, that is what it looks like if you're a denture wearer and you have no dentures in your mouth. That shows so much. You could see the despair in her eyes. You could see the collapsed face. One afternoon, teeth come the next day. Happy smile.
Oh my goodness.
And look at this. I took it from the side. You can see the contours. It's quite a beautiful smile for her. And she's out jogging.
Now, when they see this for the first time in the mirror, you say a lot of them get choked up.
Okay. Choked up is one of the reactions. I call that the reveal.
Okay.
Okay? I see all sorts of things. I see people actually cry. People go, oh my God. Or, dang, doc. I have a Jamaican gal. Dang, doc. Another gal just the other day, she said, you did good. And she punched me in the shoulder. So we see everything from joy to emotional tears. And it's a release.
Good.
And it's why I actually like doing this. This is what powers my practice. Here's the next patient, Randy.
All right. Oh, that's got to be unusual. This is pretty bad.
No, it's not unusual at all. You don't see it because many of them are walking around with their lips closed.
Okay.
They're not smiling. You don't really see what's going on. His options, you could see all the teeth falling apart. A denture is an option, or he could have a new set of teeth. And that's what we did for him. I'd like you to look at this. He's holding up his before picture. He's with his wife. You see he's standing by our wall of fame. The patient's goal is to have a picture with me at the wall of fame, because we show them, they ask for it, because we show them when they come in a case that's similar to what they look like when they're presenting to our practice. So we like it, they like it, everybody's a good time.
We're going to take a quick break. We come back, more about the implant process. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I don't know what to say. It's like it's there forever. No pains, no sensitivity, eating no problems. I can't imagine it would be so easily done. I owe you my life, doctor. I don't know what to tell you. I mean, this one thing I don't have to think about anymore. Now I can think about other problems in my life. Seriously, I was thinking about my teeth every day, forever. And now it's just all of a sudden gone and I don't know what to do with the time.
And when I eat, I can chew, I can bite, it feels good, it cuts well, I don't have any problems with it at all. It's really an improvement. I don't think I've ever chewed that well in my life, actually. You know, and the tops, the bottoms are great, and the smile is wonderful, and I'm talking better. The talking wasn't as difficult as I thought it would be, and I love them.
And you'll be ready for your daughter's wedding?
Yes, March 10th, I'll be all set and smiling for all the pictures, which I never thought I would be again, so it's amazing.
Thank you.
And everybody said how great they looked, everybody, and I'm showing them off to everybody.
I've had the implant bridge. It's virtually pain-free. I have a little bit of sensation, a little bit, but other than that, it's fine. Everybody thinks they're natural teeth. We don't have chiclets or oversized teeth. They fit with the other teeth. The coloration is similar. It frees you up from having to worry about dentures and eating certain foods.
I'm Steve. The procedure went really well. I had no pain, no swelling, and everything looks great.
When did you have the teeth taken out?
Yesterday, and teeth were put back in today.
How does it feel?
Feels great. Can't wait to go eat something.
I just love my smile, and I just want to let you know that I went to several surgeons in South Florida, and they told me that they were unable to actually create my new teeth with implants because I had too much bone loss. And so I found Dr. Krauser, and he really did it first go around. My teeth are perfect. I love them. I can now smile. I can talk. I have a lot of confidence. And so I just really appreciate this good work. Thank you.
I just had my teeth done 2 weeks ago, exactly 2 weeks. I went to church Sunday, and the ladies said I looked young, and my hair looked good. Haha, I didn't tell them what I did. Okay, and the teeth are great, I feel great, and I know I look great, I got the compliments.
I'm so excited. It looks amazing, they feel great, and I have my smile back.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have Dr. Krauser. Okay, so I know you have a stack of photos. You want to show them, so we'll kind of rush you a little bit.
Okay, sure.
But you're saying nobody should be wearing a loose-fitting denture.
Absolutely.
And if you've been told you're going to end up in a denture, they need to come see you, you say.
Absolutely. We have techniques, implant systems to give them a set of secure implants so they have their next set of teeth for the rest of their lives.
Okay, good. Let's take a look at a few of these.
Okay, take a look at this fellow.
Okay.
He came in, recently retired. They have some discretionary income. They want to fix his smile. When I say they, because he and his wife were very close in this discussion. I looked at him and I said, you have a beautiful smile. And they both looked at me like, what are you, nuts? I said, I see the smile to be developed.
Very nice.
See, he does have a nice smile.
So he would have ended up in a denture.
It ended up a denture. How about this lady?
Okay.
So her concern was she wanted to have a beautiful smile for her daughter's wedding. It was coming up in about 2 or 3 months. So we had time to set it up and do it right. If you look at her dentition, you see that there's missing teeth, loose teeth, plaque, calculus, gum disease, chipped teeth, broken teeth. You name the dental disorder, she had it. We were able to create for her upper and lower set of new teeth. Look at her eyes. She's smiling not only with her mouth, you see her eyes are twinkling. So that's what I like to see when their whole inside comes out and we see how they're smiling. This guy came in, he was a curmudgeon, very grumpy, hardly smiled. Look at him now. He became like the bon vivant of where he lives. He has a better relationship with his wife. They're hugging each other. And
So again, you could not save those teeth. Remove the teeth, give them a brand new set of teeth.
with heroics, you could probably save the teeth, but we don't believe in that. We want to give them something that's predictable, that will be long lasting, and will look good. And look how happy he is with his wife.
Very nice.
Take a look at this gal. She came in, she had the big gap between her teeth, but she also had advanced periodontal disease in the rest of the teeth. They were actually like flapping in the breeze. If she closed down, they were ready to fall out. So her options, a complete denture. She said, please, anything but that. I have relatives that have it. I don't want it. So we were able to give her what she wanted.
Very nice.
And she's thrilled. We're thrilled. Everybody's happy. Take a look at this before and after, side by side. She was sitting at home, stopped working, put on 40 pounds, miserable. It took us 3 or 4 months of discussion where she was so nervous, she finally did come in.
Wow.
Beautiful. So here's another patient. You could see, even if you're not a dentist,
Okay.
that she has advanced periodontal disease. She owns a restaurant. She's dealing with the public all the time. We gave her an upper and a lower new set of teeth. She's at the restaurant. We stopped by to see her for lunch, and she's happy to see us.
So those look natural. I mean, it's very natural.
It fits to her body. If she feels good, then not a single issue that bothers her.
Time for one more.
Okay. We have this younger gal. She has a imperfection in her enamel. Her teeth become super decayed.
Okay.
They rotted out. They fell out. She didn't even know where to go. People didn't know how to even treat her. So you can't even save those teeth if you wanted to. We gave her top and bottom, new set of teeth.
Wow.
And she's great. Now,
It's like a model now.
great looking gal. Now, this is funny. That picture underscores the fun we have in our practice. She gave us permission to put her on our website. She came in another visit, and I showed her, there it is on the website, and she's given a, look.
That's very
I'm excited
nice.
you're on the website.
That's very
So,
nice.
Randy, I have a whole pile here of more cases.
Well, we're not going to be able to get to
but
all
I
those.
understand. So
They're on your website, though.
they're on the website, and I'm so pleased to have done this interview with you. And
Well, thank you.
We're
Good stuff.
hoping that
Final message, though.
Yes.
Somebody watching this, maybe their teeth are falling out. Bad teeth. They're headed for dentures. Or the other crowd, the denture wearers. Let's say they've heard what you had to say, but they're still skeptical. What do you say to them?
if you're skeptical and you've seen this show, call us up and we'll give you a complimentary x-ray and discussion about what your options are, what the fees would be, and we could take it from there. So you're welcome.
And you do it all right there, all under
We do
one
it-
roof.
It's one office. I have the equipment. I have the surgical suite. All the prosthetic department is there. We're able to help the patients under one roof. And we have fun doing it. And we welcome you to come see us.
All right, I want to thank you for coming on the show. Good stuff.
Thank you, Randy.
Great stuff.
Thank you very much.
Thanks. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.